My name is Fawn Lopez. I'm publisher of Modern Healthcare. We're back for another episode of Fridays with Fawn. Joining me today is Dr. Cheryl Pegus, Executive Vice President, Health and Wellness at Walmart. Welcome, Cheryl. I'm honored and delighted to have you as my guest today.
Thank you so much, Fawn. I am honored myself to be with you. I feel as I'm in a meeting to talk about not just wonderful topics, but with one of the true pioneers and leaders of what healthcare can be in the future. So just thrilled to be with you.
How kind. Thank you so much. So to get started, I'd love for you to walk me and our audience through your career journey, especially your journey from medical school through to your current role today at Walmart. Any ups and downs, and how you made career decisions and trade-offs.
So what I would say about my career, it's interesting. Everyone always asks you, how do you know what you'll be when you grow up? I think for me, I've always had an interest in doing something that worked with people and allowed me to be close to people. I was actually raised in a community with lots of other children and spent a lot of my time, weekends, other time with my grandparents, who were everything you expect grandparents to be, in allowing you to climb trees, stay up really late, do anything that you wanted to do. When I was around 11, my grandfather got really ill, and we could not afford health care. And frankly, one of the major hospitals in town did not, at that time, take African-American patients. And so we cared for him at home. And it allowed me to continue to see someone really feel as if they were caring for their family, even though we all felt just really naturally we could care for him. And it created my interest in healthcare, of what I would want to do, and hopefully how I would go ahead and do it. And so a lot of where I am today are those early experiences in choosing the careers. Probably today, my grandfather had diabetes and had a diabetes ulcer that we took care of, that I didn't know then. But a lot of that, right? How do you get access to care? How do you ensure that care includes the family? And making sure that people have trusted resources, and how do you bring the right level of expertise, and so that you're really impacting morbidity and improving quality of care and quality of life. That's where it started for me, and I've been on that road and path and journey ever since. And I hope I've made him, we called him Papa, I hope I've made him incredibly proud of this work that I absolutely love doing.
So I now know why we connected so easily when we first met. My grandfather was my best friend growing up, and he was everything to me. So nice to hear your story about your grandfather.
He was pretty special.
It's just awesome. We're so lucky, right?
Exactly.
So talk a little bit about, how any ups and downs through your career throughout, the last maybe 20 years, 15 years.
So here's what I would say. I think this is not easy work, not because of the intellectual work that has to happen, because a lot of healthcare is actually quite simple. It is ensuring that you understand what are the priorities that you're trying to solve, and then ensuring that everyone can at least feel as if they got to contribute to what those solutions could be. And I would say my career has really been around that path of, yes, we've seen a patient come back every 2 weeks. and they get hospitalized. And for a clinician, it may just be this person's not taking their meds. From the way I look at care, it is, did we understand if they could afford their meds before they left?
So true.
Do we know what else they're taking that could have a significant side effect? Is it frankly just easier on a Sunday evening to get your care because Monday through Saturday you're caring for a family and you've got to be at work every hour? And so the ability to bring in those perspectives, if you will, for me seem pretty natural, and feel as if that's what we should always do in healthcare. And it's how I've always approached it. Hasn't always been fully receptive by the traditional healthcare system. And so what's great about healthcare is the data doesn't lie. And as more data has come out, we recognize that those social determinants and those personal behaviors actually drive 70% of healthcare cost. And we now talk about them. But I would tell you in my training, where the resident or the intern stays behind to talk to the patient, those were then unique. And I probably recognized those needs, particularly in underserved populations, minority populations, and then in cardiology, recognizing it for women and what they may need. And so I think the lesson there is that we all bring something unique to healthcare. And what's needed is all of us together figuring out how that helps that individual patient, how we personalize what we do. So there's a little bit of that journey that you come through. And now all of a sudden people are like, wow, that's pretty brilliant, that work you did 10, 15 years ago. So I would tell everyone, when you hear like, oh, look at what this person's done. Sometimes you don't know. No, they've been trying that for 20 years. It's only recently
You're talking about it.
Yeah.
So you've had an amazing academic and professional career. You were the first African-American woman to complete a fellowship in cardiology at, Cornell Medical College. And so congratulations. I'd love to know, as a cardiologist in a predominantly male specialty, and it's important as well, as an African-American physician, what strategies did you take to succeed?
Yeah, and here's what I would say about cardiology. First of all, I tell everyone you should go into healthcare. It's the best profession in the world for women because you can go off, as I've done, and have your 2 children and come back and just pick up your career right where you left it. It is yours to manage once you've earned your degree. And so there's the beauty of that and knowing it. I think what's challenging in cardiology is that with everything that we do, you need momentum of a number of people. Yes, you can have a voice. Yes, you can influence, but sustainable change requires multiple people with you. I actually did my cardiology fellowship where I went to medical school and where I did my internship residency. And why is that? Because that was thoughtful. It didn't just happen. It was because they'd seen an African-American intern and an African-American resident, a female, who was then going to be a cardiologist. Some of those proof points were already laid. And I actually looked at other institutions simultaneously. And really, I've given shout outs to a number of leaders at that stage in my career who quickly shared, you're going to do great, but you'd be the first in an institution that's not had even African-American residents. That would be challenging. And I know there are some people who would think, oh my gosh, I can't believe someone said that to you. That person is actually a friend and a mentor and was doing it to say those barriers are the ones that should be lowered because the next 3 years of this cardiology fellowship is really hard work. And what you want to do is get to do that work with people who already see you. And I say that as see you, and really able to help you recognize your talent and potential. And so that for me has been critical throughout my career. I am very aware of who I am. I love for the people around me to be as aware, so that we can meet in what our commonalities will be and how we will do things together. And I hopefully have sought that out and continue to.
Good for you. So, after all of your years of schooling and clinical training, what was your motivation to transition from the clinical side to the business side of healthcare?
Yeah, so healthcare is a really interesting business model, right? So the people providing care are pharmacists, nurses, doctors. The people leading healthcare are people who come from business backgrounds. And there are times when, again, having different skill sets really matter around the table, but you've got to be able to communicate and be able to have everyone recognize that actually we've got to focus on health equity. No, actually, you need the data to be able to help you to predict high-risk patients. And so when you're taking care of one patient at a time, you don't necessarily think about that. And frankly, when I trained, we didn't have value-based care where we were looking at populations, and where today I think many young physicians are very aware of the skill sets that they have to have. But those skill sets are necessary to help innovate healthcare in where we're going. And my interest, as I've said, it's how do I improve access? How do we take care of patients or communities with the needs that they have? And the way to do that is actually top down. It's not when a patient comes to you, it's before they even know they need healthcare. It's when they go get food, and that's a part of healthcare. And so my transition has really been to take all of the things that I think we know encompass whole health and begin to see models to not just do it from a business perspective, but to have it be sustainable. I think many in healthcare know all of the things we have to do. We've seen the studies over and over. What we as leaders and people who want to transform healthcare have to do is say, here are the sustainable business models that we all should follow. And so I am hell-bent on those data-driven business models that allow everyone to see, here's how you can do this successfully, not just based on the economics of a community, but actually all communities. Because in this country, we spend almost $4 trillion on healthcare. There is a lot of changes in our business model that we can do.
So great. So you're a co-founder of New Beat, an organization dedicated to improving the cardiovascular health and careers of women and underserved represented minorities. And prior to joining Walmart, you were president of Cambia Health Solutions, Consumer Health Solutions, and also its chief medical officer, where you were also responsible for clinical and consumer strategy to increase access to affordable care, which you talked about. Now, as the executive vice president of health and wellness at Walmart, what is your goal and vision for the future of healthcare?
So it's this is almost coming back to where you started, right? Healthcare is how an individual consumer, a person, should receive it, not dictated by me. And for some people, it should be around their work schedule and their life schedules. And they don't all need to come into a doctor's office to receive care. And so the first thing that I think about when I think of someone's healthcare journey, it's, am I giving them all of the access that they need? And we look at that in an omni-channel manner. So are we giving you access to healthcare in home, digitally, or in person? So the first thing we think about is our strategy is to have omni-channel care access. Our second is to focus on health equity, clear clinical outcomes, and to utilize data and technology to ensure that it's human-centered, but allows our humans, be it our community health workers, our pharmacists or physicians, to be the most effective in being able to provide care. Because we all know it is not just that you go out and care for a community, but it's really how we're enabling efficiencies to allow you to care for yourself. Because the better you are at caring for yourself, the more able you are to care for communities. And that's our strategy. How do we ensure that we care for our associates in a human-centered, tech-enabled manner that allows us to improve omni-channel care for the communities we serve and measure our success by the engagement, improvement in health equity, and improvement in health outcomes? Pretty simple. I'd hope everyone is doing the same thing, but for us, it's pretty crisp, pretty clear, and fits in with Walmart's overall mission, live healthier, right? It's everyday low prices. It's all of the things that you think about in healthcare. So my being at Walmart allows me to realize what I believe healthcare should be. And I'm not bringing up new philosophies or new strategies. It's building on what this company has been built on from day one.
Thank you for that. This is awesome. So we all know that there are real barriers to career advancement for women and minority groups. What would be your advice for women and minorities who are preparing for their next step into an executive position in healthcare?
And so there are a couple of them. The first one is be comfortable in your skill sets. If you feel you have a gap, you should go fill it. And I think many people say, you're a physician, how did you learn business? Well, I tell them I got my business degree by marrying a portfolio manager and then getting an MPH as well. And everybody contributed, though we don't share in the degrees. But I think if you feel, right, that I don't know enough about accounting, I don't know enough about managing a P&L, go learn it. After medical school, by the way, everything's easy. Just saying that. So it's important to build upon your own skill sets because it not only gives you confidence, it allows you to know your potential to continue learning. And healthcare is a continuous learning journey. Really, really important that everyone gets that. I talked about health equity and social determinants. No one talked about that 20 years ago. Value-based care, no one talked about that 10 years ago. Digital telehealth, and these are all new different ways, use of AI and ML. And so you have to be a continuous learner. That's how you succeed. No one who you believe is successful isn't up reading, taking courses, attending conferences, speaking to people. So that's one. The second I would say is have a team of mentors and supporters. Really, really important, because for everything that you're thinking of doing, someone has thought of doing it before or someone has done it before. And it is okay to build out a team of mentors and supporters who are there for you to ask what you believe are the silly questions. Oh, I can't believe that someone would feel that I don't know that. There's lots we don't know. I find that my best conversations happen with people who just look at me and they go, why do you think we should measure data in healthcare? It's a great question. People should ask that. And so I do think having a team of people to go to is the second. And then the third is have a plan. You've got to figure out, where's my endpoint that I want to get to? And by the way, there's no endpoint that's minimal if it's yours. Own your endpoint and ensure that you have a plan for getting there. Ensure that you have your life that you're living and loving living be part of that. And so if you love, to travel, make sure you're spending time on that. I love to cook. I make sure I spend time on that. And then make sure that it all fits into your life, because you want to get up every day and feel happy and feel fulfilled and feel like you're working towards something. So for me, those are the three things that I really spend a lot of time on, and hopefully in a New Beat and other organizations help mentor others that way.
That's great advice. Lifelong learning is such important. So when I was growing up, one of the things that my father used to say to me is, whatever you do, get an education. Education will give you the confidence that you'll need to do things that you might not attempt to do. So your advice is just spot on. Thank you for that. So one of my favorite questions of leaders is this: what keeps you up at night? So what is keeping you up at night, Cheryl?
Yeah, what's interesting is this past year awakened are you doing enough in healthcare and for social increase in health equity? And I think the thing that I think about more than anything else, honestly, is how am I helping the next generations? And am I contributing enough? It's right. It's not just that, what have you done, but it's really how many more are doing this type of wonderful work, how many more people have the opportunity. And work can be all consuming at times. And I think last year, for many of us in healthcare, managing COVID-19 day to day took a real strain. I think the time of ensuring that you're listening, being a sponsor, being a mentor, sometimes sharing some truths, I have to make that time. For me, it's really, really important at this stage in my career and the work that I'm doing, so that there are many people who are probably having what I thought of 20 years ago as normal. And they're like, my goodness, look at these leaders. Don't they know this is where it's going? And for us to be able to listen and include them today. So it's mentorship. It's ensuring that you have forums where you're bringing others in to what I think is the best career. It's ensuring that women know that what they contribute is equal and matters, and making sure that I'm a visible, if you will, advocate for these areas. So it keeps me up because the 24 hours of the day limits some of that. And so it's really taking some accountability of my time and ensuring that I'm devoting it to that. Because when I look back 5 years from now, that's what I know I will count as success.
Good for you, and thank you for that. So I've heard that you have two fun ways to escape work. One of them you talked about earlier, cooking, and interior design. So tell us a little bit about how you got into these hobbies and how they help.
Yeah, so it's interesting. So I've mentioned my grandfather, and so my grandmother actually lived until she was 104. And
Wow.
with my grandfather, I was that grandchild who would wake up early in the morning to help with the morning cooking. So spent a lot of time with my grandmother. And I used to say when I was actually in medical school, those nights after you've done 36 hours and you've been in the anatomy lab, I'm like, on any given day, I could go back to baking bread. I know how to do that really well.
Oh, you have to teach me.
My grandmother actually taught me really well. And so a number of years ago, and I tend to find myself really wanting to make sure that I don't kind of leap over the things that got me to where I am, because it's what makes me who I am. And I want my children to see that that's actually important at the end of the day. And maybe everyone saw it in COVID-19, right? Family mattered, caring for yourself mattered, looking at your communities. And so my grandfather and grandmother had a huge impact on me. And what I did, though we didn't always grow up cooking everything the healthiest way. It always tasted good. I took all of these recipes and made them cardiovascular healthy all the way down to counting the calories and did a cookbook. And Everyone Eats, volume 1. And that was just really for me to capture how important that's been for me. And then a couple of years later, my first child was going off to college. And even though I cook a lot and everyone in the family cooks a lot, turns out some people were great taste testers, not cooks. And so I did a cookbook for people going off to college of, no, here are the things you should know.
So
Here's
cool.
what you should have. And that's actually been a lot of fun. And I've gotten to do something with actually a number of colleges around the country. It's always great when a parent says, oh my gosh, I couldn't get him to do anything at home. Now they're showing me a recipe. So there we go. Those are two things, but really important for me. Look, cardiovascular health, and I know we all think about heart disease. Actually, about 60% of your cardiovascular health is based on your diet. And some of that is just eating healthily. So it took my love of my family's culture, the way I want my children to see how important that is, and my interest in improving cardiovascular health. It just checked a lot of boxes. And I got to do it with my family. I would just say for both my cookbooks, my husband's the photographer. You already know I've got a food taster, and I had sous chefs. So it was a lot of fun.
Wow. What great story. So didn't know that you are also an author, which is great. I love to cook also. So talk a little bit about the interior design hobby. I understand you have some kind of degree.
So it's actually the one I hang in my office. Forget those medical degrees. So, you read, learn the things that kind of just give you joy. And I actually see cooking and the space that you spend your day in, right? As these are the ways you define your health. And for healthy living, for those of us who've taken care of people with asthma, if you live in a home that's fully carpeted, you may have more triggers. If you are in a home that doesn't care, particularly with children, the types of paint. So there's a healthcare aspect to this for me, because I believe if we truly in this country gave everyone great healthy food and improved their living environment, we would not have all of the serious chronic medical conditions we do today. So that's that piece of it that drives me, and kind of how do you take your passions and improve health. And so I went back to school, actually to Temple, and got my interior decorating degree, and hang it proudly, because it was really hard to go back to school after all these years, by people who, by the way, it seemed to come naturally to. And I was learning a lot of new techniques. But again, that quest of how do you grow, you learn and you challenge yourself. And it's actually on your own schedule in the ways that you do that. And I've had the wonderful opportunity of being able to do some healthy design, of building spaces that are healthy design spaces affordably. Fawn, as you know, I probably, like my grandmother, will be here a little while. I've got a couple more careers in me, and these two are up there on my list.
That is just awesome. So I've met high achievers before, but I would put you in the category of super achiever. Super achiever. Amazing. I love the story. So thank you for sharing.
Thank you. Those things don't feel like work. That's the great thing, right? Actually, my day job doesn't feel like work. So when you're doing things that kind of feel like it's how it may have been, that's why you're here, it goes a little easier.
Absolutely true. So I want to get a little political right now with you. So just yesterday or the day before, I believe, I can't even remember the day now. Just every day is the same to me. But so the House just recently voted down equal pay for women. So as a woman who has worked to get to a top position, senior position at one of the largest corporations in the world. What was your reaction to that, and what can women do to try and change the status quo?
Yes, so there are two things. One, be in the room where the decisions are being made. You asked me a little bit about transforming from being a physician to being a physician executive. Be in the room where the decisions are being made. Make sure that the data is transparent and available, and that you talk about it and you use it and share it. This comes back to not only having mentors, but if your mentors aren't having this conversation with you about how you manage compensation, and look at what that is and really become knowledgeable about it. So that continuous learning piece, it's really important. This, by the way, exists dramatically in healthcare for female physicians compared to male physicians, even in the cardiovascular field. Know your data, go in with it, and ask for your worth. I think it's really important that we not only do that along the way, but when we get to the positions where you're in the room where the decisions are being made, that you ask the question. It'd be great to see what pay equity looks like across the organization. It'd be great to understand what are the skill sets that are allowing it. And I'm not sure, I always think that the government will be the rescue here. I think it's what we started with. You may be first, you may be only. The only way you get to not be the last is because you ensure that you set the table for others to follow you. And it is a responsibility. And you have to, at some point, just own that responsibility. And I fully own it. I'm okay with it.
That's amazing. Thank you. So you are speaking at our 11th annual Women Leaders in Healthcare Conference next month. Why do you think it is important to participate in a women's conference, and what do you expect to get back?
So the reason it's important is some of the issues we've talked about today. There is a lot that we should be sharing and ensuring that everyone knows that they're not individually unique. We've all had common experiences, and we should allow ourselves to share those experiences and how we've either been able to succeed through it or the ways that we have taken one step backwards so we could move 2 steps forward. We have to have those conversations, and we should have them transparently. In healthcare, we talk about the Sunshine Act, just about ensuring, right, that everything we do is above board and legal. I think from a support perspective and a career perspective, more of that needs to happen for women, supporting women. So right here for it. And this is not just about the careers, but we do know a lot of these issues that are structural, that may be holding someone back from realizing their full potential. There are maneuvers to be successful. So sharing that's really important. What I hope to get out of it is what I hope that this stage of my career journey is, that I'm letting people see there's nothing you can't do, that it's okay to be different in an organization where there may be a lot of people who have similar characteristics. What you bring to the table can be beneficial. And it's also to show that the work of healthcare requires everybody. And so that everyone should feel that they have a role and that their role is important. So for me, that's, I hope it's who I've always been, but definitely who I want to be today.
Thank you. Well, Cheryl, it has been an absolute pleasure and an honor to speak with you today. I could spend the next 3 hours talking with you, but unfortunately our time is up. I can't thank you enough for sharing your valuable time and insights with us. And, but more importantly, thank you for your commitment to advancing women and minorities. And thank you for your commitment and dedication to providing accessible, affordable, and equitable care to all Americans, but especially those that are underserved. And it's so important. So thank you for that.
Thank you. I would just say many people hopefully know this. You have made it your passion and interest to make sure that healthcare is an inclusive environment for women, for underserved minorities, and for sometimes addressing and asking the questions that people sometimes have kept silent. Without organizations like yours allowing us a platform to talk about some of these issues, they don't become change agent times. And so your work's incredibly valuable. I know for many of us, I've known you for a long time, not just admire the work, but some of how I get to do what I do is because you were there first in opening the door for us. And so everyone should hear that and know that. And I think you pass batons, and it's my turn to continue to do that. So thank you very much.
How kind. Thank you. Means a lot to me. Thank you to everyone for joining us today. And as always, I look forward to seeing you on the next Fridays with Fawn. And I hope you'll join me and Cheryl, Dr. Pegus, at our virtual Women Leaders in Healthcare Conference on July 22nd and 23rd. We've put together an outstanding program and an amazing roster of speakers for you. And I look forward to seeing you there. Thank you again, and see you next time.